We know type 2 diabetes can be hard to manage despite your best efforts. But there may be a better way. With clinical research in people like you, each clinical research study conducted provides more information to help advance the treatment of type 2 diabetes. Which brings us to the Revitalize 1 study. We are looking for men and women ages 21 to 70 who take basal insulin on a daily basis but have not been able to control their type 2 diabetes to be a part of some exciting research. The Revitalize 1 study's purpose is to learn more about a new investigational procedure called Revita for the treatment of type 2 diabetes in patients who are on insulin therapy. We are evaluating a non-drug procedure that may improve blood sugar without increasing insulin or other medications in people with type 2 diabetes. Now, let's talk about Revita. The procedure, which is performed endoscopically and involves heating the part of the small intestine responsible for the absorption of nutrients. This means that it is minimally invasive. You will be asleep or sedated while it occurs, and the procedure is expected to last approximately 1 hour. In fact, you will be able to go home the same day and resume your normal activities the same day. Following the procedure, you will follow a 2-week diet and you will restart your medications as instructed by the study doctor. You will be monitored by a diabetes doctor to ensure that your blood sugars remain stable and your medications are appropriately adjusted. It is thought that the procedure may help to restore your body's ability to help control blood glucose, improve insulin resistance, and improve control of diabetes without increasing medicines or insulin. Revitalize 1 study participants will be randomly assigned to one of 2 groups, one that receives Revita or one that receives a sham procedure, also known as a placebo procedure. The sham procedure will not include the treatment. This is done so that results can be compared and the benefit of the procedure can be clearly understood. But don't worry, if you start off in the group receiving the sham procedure and are still considered eligible, you will be offered the opportunity to receive Revita later in the study. Before your participation officially begins, the study team will go through all the important elements of the study and procedure with you. They will also review your medical history and answer any questions you may have. If you are comfortable moving forward, you will then undergo a physical exam and a series of medical tests to make sure you are a good candidate for the procedure. For those eligible to participate, the study will last about 1 or 2 years depending on the procedure you receive and consist of 3 periods: screening, procedure, and follow-up. The screening period will include 3 study visits at the study center or your home. It is during this period that it is determined if the study is suitable for you. If you are deemed eligible, you will make 1 visit to the study center to have the procedure and go home the same day. As for the follow-up period, this will consist of 6 study visits at the study center and 5 phone calls. You will need to closely monitor your glucose daily. Those who start out receiving the sham procedure and opt to receive Revita later will continue to be followed after receiving the procedure. With your permission, we will inform your general practitioner of your participation in the Revitalize 1 study. We will request that he or she does not change your dose of anti-diabetic medications except in cases of emergency. Your study doctor will regularly review any changes to treatments or medications prescribed to you during this study. While there are always risks associated with participating in a clinical research study, they are well regulated and there are numerous safeguards in place. Participation is completely voluntary and you can decide to leave at any time for any reason. We want to thank you for taking the time to learn about the Revitalize 1 study. If you have any questions or concerns, please don't hesitate to contact our staff.